One of the biggest casualties of the 2 years of war is Gaza's healthcare system. The United Nations says only 14 of the territory's 36 hospitals are still operating. And of those 14, some of them are only partially able to operate as the doctors struggle with lack of fuel, electricity, and supplies. Our next guest has firsthand experience working in one of those Gaza hospitals during this conflict. Dr. Feroze Sidhwa is an American trauma and critical care surgeon, and he joins us now. Dr. Sidhwa, thank you so much for making time for us.
Thanks for having me.
Can I ask you, as we're seeing the trucks start rolling in back into Gaza, some of them with medical supplies, are you feeling any sense of relief today?
Yeah, less bombing is better than more bombing, that's for sure. More aid going in is better than less. This kind of shows that the aid could have been going in the entire time. But leaving that aside, yes, it's definitely a relief to my Palestinian colleagues. I'm scheduled to go back in November. And I hope that the hospital will actually have the equipment that we need to take care of people this time.
Can you tell me about your visits to Gaza during this conflict, what it was like for you? Paint a picture for us about how you operate, both literally and figuratively, in a space like this.
On March 18th, I was in Gaza. That's the day that the widespread bombing of Gaza resumed. And that was the biggest mass casualty event I've ever seen just at Nasser Medical Complex where I was, which functionally is the largest hospital in Gaza right now. It's a 250-bed facility. We saw 221 trauma patients that morning. 93 or 92, I can't remember exactly now, were dead. Half of the serious injuries were in small children. I'm talking about kids, 10, 12 and under. In that one morning, I did 10 hemorrhage control operations, meaning I stopped someone from bleeding to death. That's more than I do in about 2 months in California. And I was one of 6 surgeons operating that day. So it was just complete chaos. It was completely nuts. The people that we operated on that day, I was able to stop them from bleeding to death, but we had almost no ability to reconstruct their spine to deal with their traumatic brain injuries. And then I'll just tell you a story about a 5-year-old girl named Sham. She was the first person I found who could live that day. And she had a brain injury, but it seemed survivable. And she also had a torn left lung and torn spleen. So I took her upstairs. I took her spleen out. I took care of her lung. And then the brain injury, we just had to let heal on its own because there's nothing you could really do about it. Well, a few days later, she was awake, and the injury was, like I said, the left side of her brain. So we were worried she would never speak again, but all of a sudden she did. She started talking because kids are good at healing. And she looked at her mom. It was in Arabic, obviously. She looked at her mom and she said, "Mommy, I want eggs and juice." Her mom grabbed her, hugged her, was elated, started crying, said, I love you, of course, sweetie, you can have anything you like. And then she put her back in the bed, and then her mom collapsed on the floor sobbing because she knew there's no eggs and juice anywhere. She couldn't get her these things. So this is what Gaza has been subjected to. It's not really about the conditions that I saw. It's what these mothers, these children, these fathers, what they've been put through is just absolutely astonishingly inhumane. And I sincerely hope that Israel and the West will never do something like this again.
So as you mentioned, you're returning in November. Talk to us about what you're anticipating, what you imagine that next visit is going to be like.
Well, I hope it's more focused on reconstruction and rebuilding. But the last time I went to Gaza, I got there on March 6th, which was also a ceasefire time. And then on March 18th, it was all blown up. So I sincerely hope this one is different. We'll see. But if it is, then I hope to be able to start training new Palestinian medical students, train the Palestinian med students who haven't had any education for 2 years, try to bring some of the physicians up to speed. 10% of Gaza's healthcare workforce has been killed, outright killed. Another 350 Palestinian physicians and nurses and other healthcare workers are in Israeli captivity right now. Nobody mentions them. In addition to about 10,000 people who have been taken hostage from Gaza and are being held in Israeli torture chambers right now. So I hope that we can start to reconstruct something and rebuild something. The Palestinians want to build, the ones that I work with, obviously I'm talking about, they want to build a healthcare system. They want to build a functional society, but it's impossible to do when your hospital is literally being bombed. On March 23rd, when I was there, I was actually almost killed at Nasser Medical Complex. One of my patients' rooms was bombed, a 16-year-old boy named Ibrahim. He was killed, and I was almost killed because I was on the way to his room. I was about 90 seconds away from being in his room when it exploded. So, they want an end to that. You're not supposed to get blown up in a hospital. And I'm hoping that this time I won't have to worry about that, but more importantly, that my colleagues won't have to worry about it.
Dr. Sidhwa, I am certain that people watching this conversation right now would be thinking, then why do you go back? If it's so dangerous and so scary and you could lose your life and you are needed to also care for people in your own country, why do you keep going back to Gaza?
Well, a few reasons, I guess. I mean, I go to plenty of other places too. I've worked in Ukraine, I've worked in Haiti and Burkina Faso and Zimbabwe. I go where I'm needed, and part of that, a lot of that is here. And I do work in a very violent county in California, like you said, so I'm needed. Like that's where I'm at right now. That's why I'm in this little office. But the fact of the matter is, the United States is, and I'm an American, so that's primarily my concern. The U.S. is responsible for what's been done to Gaza over the past 2 years, and not just the past 2 years, a lot longer than that. So I owe it to these people to go and help them. It's that simple.
Do you think other doctors feel the way you do?
I know they do. There are 152 American physicians, nurses, nurse practitioners, midwives, just sent, which I led, just sent Donald Trump a letter. I believe it was October 1st that we sent it, detailing what we saw in Gaza. We had also sent 2 letters to the Biden administration detailing what we saw in Gaza. Never got a response from any of them, but that's fine. If our government won't do the right thing, we'll do the right thing. When I speak to churches, I speak in mosques. I haven't yet been asked to speak in a synagogue, but I'd love to. I speak at universities. I speak at medical schools. I speak all over the place. And people desperately want to know what's going on. They desperately want to see somebody who is doing, I don't think it's some grand thing that I'm doing. Not everybody has the ability to go to Gaza and work there. I do, so I do it. But people want to see someone doing the right thing. It's so obvious that our governments have been doing the wrong thing for so long that people are just desperate for any kind of relief, any kind of sign that humanity has not lost its way in this just absolutely insane regard.
Dr. Feroze Sidhwa, I thank you so much for your time today. And I wonder if I can ask you a month in advance, when you are there in Gaza come November, can we please pick up the conversation again?
I'd love to, yeah. And just so you know, there's plenty of Canadian physicians who've gone over too. Michael Falk, Ben Thompson, there's others as well. But yes, I'd love to. Thank you.
Okay, I look forward to that. Thank you so much. Safe travels.
Thank you.